What does pain mean to you? Your answer predicts your recovery. Lesson 4. Pain is always protection. Why do we experience pain? For all animals and humans, pain is the brain's best method of protection. This protection is both evolutionary and instinctive. Is pain always for protection? Yes. Our pain protection system is constantly there looking out for us, looking out for any kind of danger or threat, be it an actual threat or a perceived threat. Can pain sometimes be imagined? Never. Be it physical or emotional, pain is only experienced if we sense that our well-being is being threatened. There's no such thing as imagined pain. If it is experienced, it is real because it is attempting to protect you. How does pain offer protection? Pain forces us to give attention to the area under threat. Pain forces us to do something to remove the threat. Example, take hand off a hot stovetop. And pain forces us to rest, to allow healing to occur, and if need be, seek care. And when pain resolves, its memory offers us protection. The memory of pain helps us avoid the recurrence of the threat. Example, touching a lit candle, drinking spoiled milk, falling off a bike. You'll try harder not to do that again. The memory of pain is crucial for our survival. That's how we learn to avoid danger and stay alive. When pain is experienced, most of us instinctively desire to rapidly eliminate it. When a person experiencing pain seeks help, often healthcare professionals also focus on eliminating or at least reducing pain. Not that there's anything wrong with wanting to reduce pain. Sometimes pain relief is needed to just be able to fall asleep, which is necessary for recovery. However, since pain is always protection, instead of just asking, how do I get rid of this pain? A more useful question may also be, what is this pain trying to protect me from? Your answer to that question can be of great benefit to your recovery. For example, pain is protecting me from not further injuring my skin, discs, joints, bones, nerves, tendons, muscles, internal organs. If you and your doctor are certain that the pain is protecting you from one of the above structures, then you're in luck. The fact is that the body does an amazing job of healing itself within a few days to 3 months when it's given the right environment. After various injuries and surgeries, most people fully recover and their pain 100% resolves. And here's an example. A person gets a total hip replacement, which is considered a major surgery, and they put metals and pins and rods in there, and the person rests for a few weeks and does gentle rehab, and gradually they're out walking or playing golf again. Modern medicine is incredible at identifying issues with internal organs and, if need be, addressing them. What if the answer to the question, what is pain protecting me from, is not skin, discs, joints, bones, nerves, tendons, muscles, internal organs? But we don't know yet. When pain exists as protection for a specific structure in the physical body, a person can often recall a significant trauma or an injury to the body part. But what if there was no significant injury to begin with? What if the pain started for no reason at all? What if the injury was from a long time ago that should have resolved by now? When pain exists as protection for a specific structure, sometimes obvious physical changes to the body can be seen, perhaps on imaging like an X-ray or detected in blood tests. What if there are no obvious changes seen in the body part, such as swelling or discoloration? What if X-rays, ultrasounds, MRIs all just show commonly found natural age-related changes? What if blood tests all come out clear? and yet the pain persists. When pain exists as protection for a specific structure, it usually resolves with medications, physiotherapy, massage therapy, acupuncture, and if need be, in rare cases, an injection or surgery. But what if the pain persists despite all kinds of treatments? You've tried the prescribed medications, creams, physiotherapy exercises, and various therapies, but at best, they only offer temporary relief. When pain exists as protection for a specific structure, it simply gets better within a reasonable time. But what if it's been several months or even years and you continue to experience pain when you're not even doing anything strenuous? It's been months and you still experience pain with just simple daily tasks. When pain exists as protection for a specific structure, such as muscles, bones, joints, tendons, or ligaments, rest often makes things feel better. But what if you've already tried resting and limiting your activities for a few months, and yet the pain still persists? After weeks or months of resting, what is pain really protecting you from then? Is pain still protecting you from not injuring yourself when you're simply lying down? Ask yourself, do I really need to be protected when I'm just lying down? Unless it's an acute recent injury, that just doesn't make any sense. After all, many seniors live with all kinds of advanced age-related physical changes, and yet they can lie down for most of their day and report of no discomfort. What is pain really protecting you from when it's there with just sitting? Is pain protecting you from not injuring yourself when you're sitting down? Ask yourself, do I really need to be protected when I'm just sitting? After all, many seniors in nursing homes sit for most of their day and report of little or no discomfort. Ask yourself, does pain really need to protect me from standing and walking? After all, many seniors with all kinds of advanced bodily changes can still stand and walk and report of no discomfort. Ask yourself, it's been months. What is pain protecting me from when I'm just gently moving or bending? After all, many seniors can bend and lift, yet report of no discomfort. When the prediction is that protection is not needed, no pain is experienced. Simple as that. When the prediction is that protection is needed, pain is experienced. What if the pain experienced is only due to a false prediction that the activity, movement, or position is dangerous? Can our senses really make false predictions? If you're not sure, please go back to Lesson 1, Context Matters. This is the end of Lesson 4, Pain is Always Protection. I look forward to speaking with you in Lesson 5, Pain is Always a Prediction.